Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Dr. Johnson, what is menopause?
Menopause is a natural process that happens to all women. It's basically the definition of menopause is that it's your last menstrual period. So women will end their menstrual period somewhere between age 40 and 58. And then after that, you can call it post-menopause, but really it's just called menopause. The pause of menses, so the end of your menstrual period.
What causes menopause?
The cause for menopause really is just the natural process. What causes our periods each month is that our ovaries, which are down next to our uterus at the base of our pelvis, is that those ovaries make hormones each month. They make estrogen that builds up the lining of our uterus, and they make progesterone that prepares that lining for a pregnancy. And then if we don't get pregnant, then both those hormone levels fall and we have a period. Now, when the ovaries stop making those hormones, then we stop having periods. And when we stop having those periods, then we're in menopause.
What does the term perimenopause refer to?
As you get close to that very last one, that very last period, then you're perimenopause. So that means that you're within a period of time before your last menstrual period. There's huge variation in it, and it's different for every woman.
During perimenopause, how will a woman's period change?
What can happen is that they can get closer together, so they can be more than 7 days closer. So if they used to be 4 weeks apart, now they're 3 weeks apart or less. So less than a week closer than they used to be. So they can get closer, or they begin to get further apart. And they talk about the early part where they get closer, or the later part when they get further. And you can, if you're trying to predict when that very last period's going to happen, the further apart they get, probably the closer you're getting to the last menstrual period. The average woman has these irregular periods, or this perimenopause, for about 4 to 5 years. So it's a fairly long period of time. But then after that period of time, then she's done. No more periods.
What are some other symptoms a woman will notice during perimenopause?
The main symptom women notice is hot flushes. Many women will notice it even before their last menstrual period. And when your estrogen levels are low, the temperature regulation centers in your brain notice that and cause you to have this flush or this temperature raise. Many women have them during the perimenopause, and just like the periods come and go, the flushing can come and go too. Sometimes, though, flushing can cause another symptom women notice in perimenopause, and that's mood changes. And mood changes is a little more complicated. About half of women can have depression and mood changes, so it's hard to know if it's really related to menopause. But if the flushing causes you not to sleep at night, then it can affect your mood.
What are some symptoms women will notice later on?
One is vaginal dryness, which is very common. Vaginal tissue, the external tissue, which is called the vulva, they're just estrogen-sensitive tissue, and that kind of makes sense. That's where that tissue is. It's on the outside, it's on the inside, just below the uterus. So that tissue changes, and sometimes it can be dry, and sometimes it can be uncomfortable. You might have a little bit more bladder problems. Some women will notice a little bit of bladder leakage. Every woman after menopause needs to start thinking about her bones. And you just naturally are going to lose bones after menopause. That's just part of what naturally happens. Exercise is important. Getting calcium and vitamin D is important. Women tend to have less heart disease than men, which is interesting. It's a good thing, I suppose. However, after menopause, women start getting more heart disease. After you go through menopause, your breast tissue is going to naturally change. A good thing about that is you'll have a little bit less breast tissue. Just like the vagina changes, the breast changes.
Are there any treatments for the symptoms of menopause?
Probably 20 years ago, the thought was every woman should take hormones. That was not true. Having said that, then about 12 years ago, the thought was no woman should take hormones. That's also not true. And just like all medications, it has its benefits and it has its risks. Now we know that for women right after menopause, there is not any risks for using it for at least 5 years. And it's probably the best treatment for hot flushes and probably the best treatment for vaginal dryness. I think the most important reasons for any medicine, and hormones included, if you've got a symptom that's really affecting your quality of life, and hot flushes, vaginal dryness can be reasons for that, talk with a doctor about it, understand the risks and benefits, and use the lowest dose that works for you for the time that you need it.